All right, so we're looking at PowerPoint 3 for the digestive system. This will complete the digestive system for us. And today we're looking at liver and gallbladder. I would take a look at page 94 if you want to follow me along in the course pack there. All right, so we're talking about the liver, and the liver is a very large digestive organ. It's found on the right side of the abdominopelvic cavity. The diaphragm would run right along above the top side of that liver. And in fact, the ribs would cover over the liver as well, like you see here. You also notice in this image that the stomach sits behind the liver. So let's now talk about the four lobes of the liver. This side over here is what we consider the right side of the body, so that is the right lobe of the liver. And over here we have the left lobe of the liver. They are divided by this ligament that runs through. It's called the falciform ligament. Okay. This falciform ligament has an interesting history. It was actually the umbilical vein in a fetus. So after birth, of course, it anchors the liver to the front part of the body wall. Let's take a look at this picture, and I want to caution you because it's a liver upside down. Well, over here's the right lobe and the left lobe. Recognize right through here is that falciform ligament. And the way I know it's upside down is because this gallbladder right here is on the right lobe, and it's at the top of this image, not the bottom of the image. And so that helps me know that the quadrate lobe is sitting right next to it here. Okay, it always sits next to the gallbladder, and the caudate lobe is actually superior. It sits next to the inferior vena cava, which is sitting right there. All right, so there's also a hepatic artery and vein that come into the liver. They're sitting right here in about this middle area. And all the business of the liver takes place inside. So we need to take a look at liver lobules. And that's what we've got here. We've got bile ducts, vessels, liver cells called hepatocytes, and a central vein. This is going to be the driving force behind what the liver does in terms of cleaning, removing toxins, storing things like vitamins, removing heavy metals, filtering out drugs from our system. All of that takes place in this lobule system that you're looking at here. I think it kind of looks like the spokes of a wheel, and we're going to talk about how blood flows through these liver lobules in just a moment. So we're getting ready to talk about something called hepatic portal circulation. And a portal circuit is actually a bypass circuit. This is not the normal way blood would flow back to the heart. You may recognize in this very bottom of the list, you've got the inferior vena cava in the right atrium of the heart. So you probably recognize that veins normally do lead back to that IVC into the heart. But we actually have a detour here. These veins take a detour through the liver, so the liver can remove those toxins, vitamins, fat-soluble items, and store them in the liver. So we're going to start off with the capillary of a villus. Do you recall where a villus is found? Okay, that's in the small intestine. And why might we start there? What's happening in the villus of the small intestine? So we're absorbing food, nutrients through those villi, and those nutrients now are going to travel to a vein. This superior mesenteric vein is just one we're picking. You could also be leaking off the inferior mesenteric vein. So that superior mesenteric vein comes into the liver by way of a hepatic portal vein. We go through a series of sinusoids, a central vein, hepatic vein, but I want to caution you that hepatic vein is the one that dumps directly into the inferior vena cava. So we're going to go through this in detail in a couple of slides, but I do want to show you this. Don't confuse these two, hepatic portal vein with the hepatic vein. They do two different things. One brings in blood to be cleaned. Let's just be plain and call it dirty blood. Okay, and the hepatic vein is exiting the liver and it has cleaned blood. Okay, so we'll talk about what that means in just a moment. So here we are, we're in a villus of the small intestine, we know that there are capillaries that travel up inside these villi, and that's how we absorb nutrients. So anything that you take in by mouth, whether it's medications that are prescribed, street drugs, food, anything you drink, has the opportunity of being absorbed through the capillary of a villus. Okay? Here we have another view. These capillaries inside here are going to absorb these nutrients, whatever you've had to drink, drugs, anything of that sort comes into those villi. And of course, capillaries join up with a venule. And these venules take us to the superior mesenteric vein. All right, so I'm just going to circle it. Here it is. We could alternately take the inferior mesenteric vein. It too can absorb nutrients from the intestine, but we're just going to follow that superior one. I'm just going to draw a line with it, and we're going to head up here toward the liver. You notice that on our pathway, we are actually picking up blood from that inferior mesenteric vein. Other veins are joining us as we go, and here we are ending up in this hepatic portal vein, right here, coming into the liver. So I'm calling this dirty blood, but it's not dirty. It's nutrient rich. It has anything you've taken in by mouth, and that could include things like drugs, alcohol, medications, and of course food and nutrients. So nonetheless, your liver is going to take the opportunity to clean that blood as it comes in. Now, we lose the details here, so we'll come back to those in just a moment. So we've come in through this hepatic portal vein. Notice we exit by way of these hepatic veins. They are going to join with the inferior vena cava, and from where do we go next? Where do we go after the IVC? All right, we go to the right atrium of the heart. Okay, so we're getting most of the flow in this image from the superior mesenteric vein to the hepatic portal vein. We go into the liver for cleaning, storage, and then we exit by way of hepatic veins to the IVC to the right atrium. So here's what's missing. You don't go directly from the hepatic portal vein directly to the hepatic vein. There's actually some steps missing here inside the liver. So now I need to take you to a different picture. Good to go? All right, this is nice and clean. Superior mesenteric vein takes us to the hepatic portal vein, and then now that's where we're going to change our story and get into the details here. All right, let's see, what do we recognize? Right here is a branch of the hepatic portal vein. That branch is set up around a set of lobules. Remember, we were looking at one of those just a few minutes ago. There's a vein in the center that's called the central vein. Okay, and there are hepatic portal vein branches scattered all around the edge of this lobule system. And so each one of these groups of three, 1, 2, 3, contains a branch of an artery, a branch of the hepatic portal vein, and then a branch of a bile duct. Okay, so each one of those three is a branch of the portal vein, branch of the hepatic artery, and a branch of the bile duct. All right, so we're going to come in through one of these. I'm going to call it hepatic portal vein. Okay, that's another hepatic portal vein branch over here, and another. So we could go around and label all of them if we were interested. Now, just like you're drawing the spokes of a wheel, when you come in, ultimately, you're going to connect up with that central vein in the middle. Scattered all along these branches of the vessels are cells called hepatocytes. Okay, so what I'm drawing right now, these are cells called hepatocytes. All right, that's enough of them, right? Okay, so these cells here, hepatocytes. As blood flows in through a hepatic portal vein, it travels toward this central vein, okay? And these hepatocytes scattered on either side will remove glucose. It'll remove fat-soluble items like vitamins. Anything that's fat-soluble may be taken out and stored here. Waste products, maybe medications or drugs, are metabolized here or broken down. Alcohol, of course, is taken out by these hepatocytes. So what ultimately heads to this central vein here in the middle of this lobule system is going to be clean blood. And by cleaned, I mean the liver's had an opportunity to take out of that blood what it would like to. So here's another view. Each one of these is a branch of a hepatic portal vein, okay? And that blood flows through vessels. Here's a vessel that takes us to this central vein right here in the middle. And those hepatocytes are on either side, and they help to take out and clean, remove whatever needs to be removed. Okay, so from that central vein, we're going to link back up with the hepatic vein. All right, so here we are with another image that shows us that blood is flowing from the superior mesenteric vein here up through the hepatic portal vein that goes into the liver. So to conclude our review of the hepatic portal system, I do want to mention this. The reason colonoscopies are important is because if a person has, say, cancerous polyps in their colon, they may not produce any symptoms. However, those polyps or cancer cells may actually metastasize, break free, and travel the blood flow system right up into this hepatic portal system. So a secondary cancer site may establish on the liver. And so, unfortunately, the first sign of anything that's going wrong may be hepatitis, pain in the liver, or even jaundice. So that's why we want to avoid having liver cancer, because at that point it has become invasive, perhaps through all this very soft tissue. All right, so let's talk about liver functions at the very bottom of page 94. The first thing there is that bile is a major production. This is, of course, the production site for bile in the digestive system. Let's review this by talking about a liver lobule with a hepatic portal vein branch here, a hepatic artery, and a bile duct. Here's your central vein, and of course, these are vessels that connect normally from the hepatic portal vein in this direction. Well, bile is actually made countercurrent. That means flowing from vessels near the center in the opposite direction toward that that bile duct. So when bile is made, we know it's made from the breakdown of hemoglobin and red blood cells. That's what gives the yellowish green color to bile pigments. And so bile also contains salts and phospholipids, which are the most important component that help to break down or emulsify fats. All right, so do you recall what emulsification is? That takes large globs of fat and breaks them into smaller, more manageable globs. And in which organ does this occur? Small intestine. All right, so the hormone you'll notice in the very bottom of page 94 that stimulates the liver to release bile is secretin. What does cholecystokinin target? CCK targets the gallbladder and the pancreas. All right, so let's flip on over to page 95. All right, so let's talk about this top of page 95, other non-digestive liver functions. So we can store glucose as glycogen in the liver. This is reaching back to some earlier conversation. Which hormone drives the transformation of glucose into its storage form of glycogen? Is that insulin or glucagon? That, of course, is insulin. Now, if you need to break down glycogen into glucose, you would then use glucagon to do that. So the liver, of course, is the storage site, or one of the storage sites for glycogen. We also store fat-soluble vitamins in the liver. Do you recall those 4 fat-soluble vitamins? They are A, D, E, and K. The liver also makes important plasma proteins. You may recall albumin from our discussion of blood. It is very important for helping us to maintain blood osmotic pressure. If the liver is impaired, then blood pressure may be impaired. The liver is also a site for detoxification of drugs or alcohol. This may include something that you're prescribed that you take by mouth. Anything taken orally that is absorbed into the bloodstream has the opportunity to travel through the liver for cleansing, storage, breakdown, removal. All right, and then finally, the liver makes bilirubin. We were just talking about bile pigments being a somewhat green-yellow color. That is what bilirubin develops from. It's a chief bile pigment. So bilirubin ultimately is broken down by liver cells. It is then excreted into the feces as stercobilin. Okay, so that's what makes feces brown. Just a little bit on a few liver disorders here. Hepatitis is liver inflammation. It may be viral in nature. It may be bacterial in nature. Even parasites can cause liver inflammation. Alcohol or poisons can also cause liver inflammation and hepatitis, as well as overdose of medications and some autoimmune disease. All right. So hepatitis symptoms include the obvious, which would be pain in the liver area. Oddly enough, you may notice other issues like breast development in males. So there's a lot the liver does that we don't talk about in this course that has to do with hormones and interactions with other organs, and that would be one of those cases. Dark urine and pale-colored stools are two warning signs of liver problems. Dark urine may mean that bile is being excreted in the urine, and so, of course, urine would be kind of the color of a Coke or Pepsi. And clay-colored stools has to do with the fact that we're looking at not enough bile being excreted with the feces. Tiredness and fatigue, general itching, that's another good warning sign to look out for. I had an aunt who passed away of liver cancer that had become metastasized into lymphoma, and one of the first warning signs she had was legs itching. So she went to numerous dermatologists, never could get this resolved, and they finally figured out that she had had cancer, and it was too late at that point. So itching is a warning sign because the liver plays a role in mediating inflammatory responses. Jaundicing, of course, is yellowing of the eyes and skin, certainly points to warning signs with the liver and or gallbladder, and then other issues here, which could be almost anything, everything from a loss of appetite, low-grade fever, nausea and vomiting, and weight loss. All right, so I'll let you read through these slides. These are the differences between the various forms of hepatitis. And if you would like to, you can pause this slide and read about viral hepatitis. All right, so cirrhosis of the liver is often associated with things like alcohol, but medication, heavy metals, toxins, other drugs can also cause hardening of the liver. You can see in this image the cirrhosis liver on the far right compared to a normal liver and a fatty liver on the left. So when the liver hepatocytes harden, they are unable to filter like a healthy liver would. And of course, yellowing, that almost looks like highlighter, it's so incredibly yellow. So those are the bile pigments that come from the breakdown of hemoglobin. They are yellowish green in color. So I don't mean to make you sick, but when we vomit, that is the color that we see. Looks like we're ready to talk about the gallbladder, which is middle of page 95. It is simply a storage sac that sits on the right lobe of the liver. And if you have your course pack handy, fill in that blank. The gallbladder sits in the right lobe. So this is one of those organs that we can live without. We can certainly have our gallbladders removed and live a functional life. Its only function is to store bile and release bile into the small intestine. So let's talk about how that happens. We know that secretin tells the liver to secrete bile. That bile may come down one of these two left or right hepatic ducts to the common duct here. And of course, bile can continue on through the common bile duct down to the small intestine. But bile also can back up this cystic duct and be stored here in the gallbladder. So which hormone is it that causes the liver to release bile? That is secretin. Okay, now CCK is the one that tells the gallbladder to contract and spit that bile back out. So when the bile is stored here, it's concentrated, and that means we remove the water so that we just have bile salts, pigments, cholesterol, things of that sort. Here comes bile back out the cystic duct to the common bile duct, and then of course it's dumped here into the small intestine, of course to digest or emulsify those fats. So on your worksheet you have yet another blank to fill in. It says how is bile stored in the gallbladder? It backs up the cystic duct. That's your blank to fill in. And we only need bile when we have fatty foods to digest. So next on your worksheet, you'll notice it says, what happens when fatty chyme enters the small intestine? Well, that's all we need. That's a stimulus for CCK to be released from the small intestine. It travels through the blood, and of course it comes here and targets the gallbladder and the pancreas. That's a separate story, right? And the gallbladder then releases bile into the small intestine. So since the gallbladder is storing bile every day, a gallbladder attack may involve pain, nausea, vomiting, often at night. Okay, and so gallstones are essentially collections of cholesterol, and there's some pretty large ones in this picture. The problem is when they travel into the cystic duct right here, they can cause a blockage here. That would cause the pain, and every time the gallbladder contracts, problems getting the bile out of the gallbladder. A little more problematic is if the gallstone gets stuck down here. Now you have blocked not just the gallbladder, but bile coming down here from the liver. This picture doesn't have everything, so let's go ahead and add it. That's the main pancreatic duct right there. Okay, and of course these two, common bile and main pancreatic, join right about there where the small intestine comes by. Worse yet is if those gallstones make their way to about right here. Now you've blocked the flow of bile from both liver and gallbladder, and you've blocked the passage of pancreatic fluids coming from the small intestine. So this case might produce pancreatitis, which is inflammation of the pancreas, liver inflammation, gallbladder problems. So that would be the case of having to remove the stone. So in some cases they can go with a little scope up in here and take the stones out. In other cases they simply remove this gallbladder in its entirety. Alright, so that should take us down to the very bottom of page 95. If you have any questions on this chapter, please let me know. I'll be happy to set up an email conference with you, chat on Remind, or we can do a Zoom or a WebEx video conference. I'll leave you with this thought. Look at those massive gallstones. All right. And something funny to think about, which is not funny at all. So you got the gallbladder over here. You've got the pancreas right there. And you've got the pancreas putting those enzymes into the bile duct. And if they get blocked, look at pancreas. There's that pancreatitis we were just talking about. All right, so that's it for this chapter.